I swear kalau dia aircon mood, okay dah.
Jangan jangan. Okay, dah kita tengah Aristotle.
Pinjam yours.
Hypothalamus.
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 Hypo?
Thalamus.
Hypo best ni. Tidak.
Aku risau tu tengok siap tu semua.
Ya. Dengar je nanti. Ya.
Aku dengar je ni. Macam
Duduk belakang sekali. Ya ke? Sangat-sangat menelaah
dia dah boleh tutup aku.
I have the power to connect. Tahu, masalahnya kan susah sikit. Pakcik.
You have lost your connection with your own iPad.
Okay dah. Santai.
Hello. Okay. Can you hear me? Boleh eh?
Boleh.
Okay, Assalamualaikum. Very good morning. Welcome back to the holiday. Bosan I juga lagi Alright. Before I start, I takut lupa. Okay, for the continuous assessment, endocrine I believe in 11th of January, right? Okay, so I'm going to introduce one OSPI questions using the microscope. Okay. I think yang tak ada repeaters ke? Yang kena ambil endocrine tak ada I don't think kan. Okay, apa-apa pun endocrine ni taklah susah. Last year's go pass. Okay, hopefully you guys also everyone can pass for this module. So because I want to introduce I want you to get exposed for the microscope during the exam. The microscope is a log microscope. I finally managed to get a log microscope that you cannot adjust the platform. X axis and Y axis you cannot adjust. You only can adjust the focus, okay, the focus, fine and coarse focus, as well as your eyepiece, jauh or dekatkan ke. There's one question only for the histo OSPI, right? During the CE Endocrine on 11 January. We have 15 microscope baru je dapat, and then it might have to be quarantined lah, few students. Maybe ada 6 to 7 cycles to complete the OSPI. And then after that, after the OSPI session, I need you to fill the questionnaire. I want you to, because I want to know, is it good or not? Is it need to improvise or not this microscope usage? Okay, boleh? Alright. So today, endocrine. This is the endocrine topic introduction. I only focus for the anatomy part only. Okay. Endocrine is made up of a network of glands. You can see there's glands, and it secretes hormones, okay, and produce slower and prolonged response as compared to nervous system. Kalau bab function ni, usually the physiologist lah will emphasize. I won't emphasize too much for the function. Okay. And then different type of hormone, setiap organs of the endocrine gland secrete different type of hormones. Okay, is a main communicator as well, other than nervous system, and it's also somehow work with the nervous system. Kalau contohnya posterior pituitary, it's work with the nervous system as well. Okay, these are the function, general function of the endocrine hormones. Okay, and these are the organs that make up the endocrine system in the body. Okay, pineal gland, hypothalamus, pituitary gland, thyroid and parathyroid, thymus, adrenal or suprarenal, the pancreas, and also the gonads for the both sex. Okay. So this is the difference between the a bit of the anatomical part, which is dark. Okay. So the endocrine, there's no dark as compared to exocrine. This is the hormones, okay, and released directly into the bloodstream. Because tak ada dark, they release directly into the bloodstream. Okay, these are all the examples. Kita dah belajar ke during first year? Paracrine, autocrine? Ada kan? Okay. Again, this is just the how the secretions of certain hormone, paracrine or autocrine. Okay. So it can be steroid or non-steroid hormones that target the cells. Okay. So these are the example of the steroid hormones, and the rest are non-steroid hormones. Okay, these are all the hormones. Okay, if steroid, aldosterone, cortisol, estrogen, and testosterone. The rest is non-steroidal hormone. Okay, pineal gland. I will elaborate further during the specific lecture. Okay, this is the pineal gland. We don't have the model in the ADH for the pineal gland. It might be damaged previously. I don't know why. I'm not sure so. However, you might can see the pineal gland in the model in the museum. Later. Okay, before that, during the practical bila next week 3 hours practical kan? I think I told you before. 3 hours practical. So we're going to divide into 2 groups. For the first half of the group dekat MPG and the second half dekat museum. Okay, there's no ADH session dekat museum and rotate. Okay, so I hope this is the first batch I do like this because I think you need to focus on the gross as well for the endocrine. Walaupun tak banyak, because some of my question in OSPI also ada gross, not only the histology. That's what I need to emphasize during the practical session as well. Okay.
Aku juga kena.
Sorry, repro. Ada apa-apa isu tak soalan I masa CA?
Tak ada, tapi
Soalan
Ada
yang
komen? Susah ke? Tapi semua ada dalam lecture notes kan sebenarnya kan?
ya, ada. Saya pun tak buka tu je.
I think I baca balik semua ada dalam lecture notes. The lecturer also receive the setiap soalan yang kami buat tu, kami dapat feedback daripada sistem, daripada komputer mengatakan this soalan is good or not, because dia macam calculate, okay, the best student, the not, the average student, the not excellent student, the system calculate, okay, dia nak tengok this soalan good student dapat jawab ke tidak. So most of my student is category excellent. Okay, so I don't think I don't think my soalan is too bad Okay, so mungkin so my soalan excellent student dapat jawab. Okay, so maksudnya semua ada lah, semua ada dalam lecture note lah. Okay. Ada apa-apa ke nak tanya pasal soalan CA, repro itu?
Tak
Tak
ada.
ada Okay.
Tak apalah. Dah lepas.
So for the final usually selalunya benda yang dah ditanya CA tak akan tanya lah. For the final, yes. For the report. Dan result pun tak tahu lagi. Jangan result.
Belum.
dah keluar ke tak?
Share lah.
Tak tahu.
I discuss with the coordinator lah, nak pasal soalan so better do the feedback after result, after all the lecturer has a result already lah then baru tahu lah, baru bagus lah, better to get AS. Okay, thank you. So the function of the pineal gland, okay, sleep-wake cycle, ni more on the circadian rhythm kalau you nak pergi overseas, travel abroad, okay, this hormone lah yang reset balik you punya circadian rhythm, okay. Then hypothalamus, this is control the release hormone from of the pituitary, so this is the hypothalamus. Okay, I tak emphasize dekat sini sebab nanti you akan belajar lagi during the nervous system. Cuma there's a few hormone from the hypothalamus. These are all the specific hormone that control the specific parts in the pituitary. Okay, so GnRH, okay, CRH, TRH, okay, semua ada specific parts in the pituitary that release the hormone, either anterior pituitary or the posterior pituitary. Okay, posterior pituitary ada dua saja, the rest is anterior pituitary. Okay, these are all the hormones. Kenapa tak apa tu?
Kat sini boleh nampak.
Oh, okay, I rasa I punya slide. Okay, then pituitary glands. Okay, this has anterior part and posterior part. Anterior part is glandular, posterior part is neural. Okay, these are all the parts in the pituitary glands. Okay, so I will emphasize later as well. Yang penting dia synthesize. Anterior part synthesize the hormones. Okay, posterior part is not synthesized. It's synthesized by the hypothalamus. Is only receive and store the hormones dekat posterior pituitary. Okay, these are the some of the cell type. This is the I nak cakap pasal cell types. Okay, so it can in the book we call corticotropes, thyrotropes, gonadotropes, either basophils or acidophils. This is more on the cell types. Okay, and it's all the where the target cell. Okay, this is the releasing factor from the hypothalamus. These are all the inhibitor from the hypothalamus as well. Okay, yang dua ni that's the posterior part, the rest anterior part of the pituitary glands. Okay, posterior pituitary. Okay, this is the anterior pituitary and this is the tropic hormones. Then thyroid, okay, again, I hope you can see in the museum the model of the thyroid gland. Okay, these are all the histology. Okay, the functional unit is the thyroid follicles. Okay, these are the lining, which is the cuboidal or columnar, the single layer. So the apical surface of the follicular cells is infected with colloid. Okay, the principal cell is follicular cell. It can be either active or inactive stage in the histology. Okay, I just go to the overview. Later in the specific lecture, we emphasize again. Okay, so inactive hormones, we call it thyroglobulin. Yeah, dia bentuk colloid. Okay, and so the active thyroid hormone will penetrate into the capillaries. Okay, again, this is all the colloids, this is all the inactive parts. Okay, so if there's presence of other cell, which is C cell or clear cell or parafollicular cells, okay, it's between the follicles. Okay, this is C cells, okay, clear cell. Yeah, I hope you can see during the histology practical later. Okay, then we go to parathyroid, dekat belakang, posterior of the thyroid. Okay, and between the posterior lobar of the thyroid. So this one, superior parathyroid gland and inferior parathyroid gland. Dia a pair, ada dua superior, dua inferior. Okay, so ada two type of cell. One is the sheath cells. And another one is ossific cells. Okay, I hope you can see. This is the chief cell yang banyak-banyak ni. Small polygonal cell, central nuclei. Okay, synthesize the parathyroid hormone. This is the ossific cell. Larger cell, more rounded. Okay, and smaller nuclei. However, there's no non-function of the ossific cells. Okay, thymus. I had emphasized during your first year CBS module. Okay, the anterior mediastinum. Tak banyak structure kan dekat anterior mediastinum. One of it is the thymus. Tapi during adult, selalunya dah regress, selalunya dah kecut. So it being obvious in the neonatal thymus. Alright, so bilobe is a bilobe, right and left midline structure. Okay, it's a midline structure. Tak banyak structure yang midline. one of the mainline structure is the thymus. Okay, these are the hormone being secreted from the thymus: thymosin, thymopoietin, and thymolin. Okay, so this is the cortex. This is the medulla kat dalam, so the outer cortex, highly cellular. This is basophidic because closely packed thymocytes. Okay, so the medulla, inner light zone, eosinophilics, due to large lymphocyte, and there's present also the vessel corpuscle. I'll explain you later. Adrenal or suprarenal gland. Okay, so ada dua, both are retroperitoneal, both are at the upper parts of the kidneys. Separate from the kidney by perirenal fat, ada perirenal fat kat and it's surrounded by renal fascia, both kidney and suprarenal. Pale cortex and dark brown medulla. Okay, this is the histology of the three cross section. Okay, glomerulosa, fasciculata, and reticularis. It is all cortex. This is cortex. This is cortex. And dalam dia, this is medulla, and this is the central vein. Okay. This is a summary of the histology parts of the adrenal gland. Semua tu ada special features. Jawapan-jawapan macam ni yang I nak, cluster of cells ke, the parallel cord or irregular cord. That's the answer yang I want. So these are what are the secretion from each of the zone, and medulla is the chromatin cells. Pancreas, you've been taught during the alimentary system, so I just focus on the histo. Okay, bila nampak slide, dia macam dia minority only, sikit je in the pancreas histology. So dia nampak macam pale ni kan, this is the islet of Langerhans. Okay, and then 1 to 2% only of total volume of the pancreas is pancreas and not pancreas. Okay, and it's more entailed. The endocrine parts of the pancreas more in the pancreas. Okay, appear as a pale staining cells, polygonal or rounded cells. Okay, the main cells of the endocrine in the pancreas is R3, alpha cell, beta cell, and delta cell. Okay, so you know, this is important. Alpha cell usually at periphery, beta cell in the center, and delta cell is everywhere. But usually it's not distinguished, possible to distinguish in the HLE. They can have a special stain or immunofluorescence to see each type of the cells in the islet of Langerhans. Okay? Clearly staining of the memory enzyme.
Sorry.
So you can distinguish it. And majority is the, okay, tengok percentage, majority is the beta cell. Okay? So sex hormone, gonadal and placenta hormones. The male and female produce is regulated by FSH and LH. Okay, FSH and LH from the pituitary, which part of the pituitary anterior lobe. Okay, in response to the hypothalamus hormone, which is gonadotropin releasing hormone. Okay, so it need the GnRH from hypothalamus stimulate the LH and FS, and both stimulate the testes and ovaries. Okay. In male, okay, FSH stimulates sperm maturation, which is inhibited by inhibin, okay, which stimulates the testicular growth. Okay, so FSH also need in male as well. For LH, it stimulates testosterone production from the Leydig cell. Okay, I hope you dah diajarkan during the histology by Dr. Sanha. So the Leydig cells, okay, one Leydig cell, okay, so it produce the testosterone. So siapa yang stimulate is LH, okay, LH from the anterior pituitary. So ingat FSH and LH also stimulate the male endocrine organ. Okay. In female, FSH promotes egg maturation and LH signal the secretion of female sex hormone, such as estrogen and progesterone. Okay, so this is the function of the LH. Okay, so both hormone FSH and LH important for development of the maternal female reproductive system or the secondary sexual characteristic, as well as maintaining the pregnancy. Okay, the placenta also secretes several hormones important for maintaining the pregnancy. Okay, this is again FSH and SH from the pituitary. Okay, and then it will stimulate FSH will stimulate the growing follicles. Okay, egg maturation and LH as well, but LH as well stimulate the corpus luteum in ovary to produce progesterone and also estrogen. Okay. So biasalah kalau macam increase kan inhibit pituitary kalau dah terlebih. Alright, testis, the primary hormone is the testosterone, is a steroid hormone. Development of the male secondary sexual characteristic and the maturation of sperm cell, development of male, okay, and these are the example the characteristic of the secondary sex features. Okay, testosterone also produced in female ovaries, but it's very low level. So semua hormon ni ada dekat both sex, but it depends. So this depends on the levels. So the testosterone is very low in female. Okay. Testis also produce the peptide hormone which is inhibin. Okay, dia macam negative feedback. Okay, inhibit the secretion of the FSH. Okay, so the primary, the estrogen is the primary hormones from the ovaries. So these are the features of the effects of the ovary towards the body of the female. Okay, and there's another hormone is progesterone. Is contribute to regulation of menstrual cycle and preparing for the pregnancy. Okay, this is the function of the progesterone. Okay, also sama macam testis, dia ada inhibit hormone which is inhibit. Okay, inhibit the secretion of FSH and also the anti-mullerian hormone. Okay, so it's expressed by testis Sertoli cell for paramesonephric ducts atrophy in male and expressed in ovarian granulosa cell in female. It's just a marker for the ovarian reserve. Ovarian reserve ni kita nak tahulah patient ni ada masalah untuk mengandung atau tidak lah. Okay, itu saja. Okay, placenta develops within the uterus, supply oxygen and nutrients, and also secrete estrogen and progesterone. Okay, and this hormone pass directly into the maternal blood surrounding placenta villi. Okay, so these are the hormones that being secreted by the placenta. HCG. HCG, okay, is promote the progesterone synthesis and reduce the mother immune function to protect the fetus, and also HPL, human placenta lactogen, preparing the breast for lactation and relaxing, okay, for preparation of the childbirth. Okay, these are the hormone released by the placenta. Okay, so these are all. This is a bit summary of the 6 key hormones that important in the pregnancy. Okay, itu saja. Alright, itu just a general introduction. Okay, boleh start with the pituitary. Ada question kan?
No. Sama.
CL tu.
Itulah CL tu apa? SCL tu. Tapi takkan lah. Tak ada jawapan, tak ada soalan.
Centered lagi.
Okay, brain gland. Okay, I hope we can see very small gland in brain. We call it pituitary gland. Okay, gross anatomy. histology and also the embryology of the pituitary gland for this lecture. I hope you can appreciate. Okay, this is superior aspect. Okay, and the stalk coming from the hypothalamus. This is anterior pituitary and also the posterior pituitary from the superior view. Okay, this is the pituitary gland. Okay, neurohypophysis is posterior, adenohypophysis is anterior. So this anterior kat sini, and this is the posterior part. Okay. So it's a compound endocrine gland composed of glandular tissue and neural secretory tissue. Glandular tissue tu means the adenohypophysis, which is anterior pituitary. Okay, neural secretory tissue from the posterior pituitary or neurohypophysis. Okay, actually it's a reddish grey ovoid body, about 12 mm transverse and also 8 mm AP. So kecil je kan, about 1.2 cm times 8 times 0.8 cm, an average of 500 mg. Okay, continuous with the infundibulum. This is the infundibulum, a hollow conical inferior process from the tuberous cinerarium of the hypothalamus. Okay, so hypothalamus ni ada banyak parts. One of the part called the tuberous cinerarium. Okay, so this one, hypothalamus. So this is the hypothalamus here. Alright, so dia ada connection to the pituitary gland. So from the tuberous cinerarium of the hypothalamus and connect with the infundibulum of the pituitary gland. Okay, this is pituitary gland again. This is the infundibulum. Okay, atas ni adalah hypothalamus. So it sits or lies within the pituitary fossa. Nama lain, some of the book called hypophyseal fossa, some of the book called pituitary fossa. Sama okay. So it's covered superiorly by a circular diaphragma cella. This is diaphragma cella of the dura mater. Okay, and pierced by the infundibulum. Okay, you can see the pierced by infundibulum, which is the diaphragma cella. This diaphragma cella also separate the pituitary gland from the optic chiasma. Okay, this is the optic chiasma. Okay, so this is the hypophyseal fossa. So again, this is the hypophyseal fossa. Okay, of hypophyseal fossa of the sella turcica. This is, I believe you dah belajar kan? The MSK module. Skull is the base of the skull because we need to see from above. Okay. This is the sella turcica that belong to the sphenoid bone. Okay. This is tuberculum cella. Okay. This is hypophyseal fossa and dorsum cella. So just a recap, the location of the pituitary gland sits on the hypophyseal fossa. Okay, hypophyseal fossa is a part of the sella turcica from the sphenoid bone. Okay, so inferiorly, the gland is separated from the floor of the fossa by the venous sinuses. Okay, this is the venous sinuses. And the meninges gland with the capsule of the pituitary gland. Ada tak meninges ni? Okay, the arachnoid mater. Okay, this is the meninges. Oh, tak belajar lagi. Okay, meninges ada 3 layer: dura mater, arachnoid mater, and pia mater. Okay, so it's blend. The part of the meninges of the brain is blend with the capsule of the pituitary gland. So that's arachnoid. Okay, it's blend with the capsule of the pituitary gland. Itu maksudnya. Okay, so these are the relation. I think this is the cut, the the axial cut. Axial cut, view from anterior. Okay, so you can see superiorly related with the optic chiasma. Tadi gambar tadi pun ada, and inferiorly related with the sphenoid bone because it sits on the sella turcica, related with the sphenoid bone as well as the sphenoid air sinus. Okay, this is the relation superior and inferiorly. Laterally ada cavernous sinus and also internal carotid artery. Okay, cavernous sinus is the part of the venous system in the CNS. This is important because dia boleh communicate from brain towards the lower parts of the neck. Sebab itulah, if any infection in the cavernous sinus is going to spread into the brain, it's dangerous. Kind of important area. Okay. So parts of the pituitary gland, again, neurohypophysis is posterior and adenohypophysis is anterior. Okay. Neurohypophysis is the diencephalid downgrowth connected with the hypothalamus. Adenohypophysis is an ectodermal derivative of the stomatodeum. Okay, ini macam embryology derivative lah. Satu from the diencephalid, satu lagi from the ectodermal. Okay. Kita start with the anterior pituitary first, or adenohypophysis. This is the anterior pituitary. This is the anterior view, belakang ni. This is posterior view, hypothalamus, and this is the pituitary. Okay. So the three parts of the anterior pituitary. Okay, pars distalis yang paling besar, ataupun nama some of the book called pars glandularis. Glandularis, so it's the same. Pars distalis and pars glandularis is the same. So it's composed of the part of the anterior pituitary tissue. Okay. Then pars intermedia, dia macam sikit je, it's just a remnant of the posterior wall. Okay, small area here. And last but not least, pars tuberalis. It surround the infundibulum stem. Okay, it surround the infundibulum stem. So the pars tuberalis is still considered a part of the anterior pituitary, not posterior. Okay, and it's highly vascular. Okay, you see, this is the anterior pituitary. Okay, it's highly vascular and consists of epithelial cells of varying size and shape, arranged in cord or irregular follicles. I will explain in the histology part. Okay, then neurohypophysis, pars posterior or pars nervosa, okay, ataupun neural lobe. Okay, then infundibula ataupun infundibular stalk, or infundibular stalk or infundibular stem somewhere. This one, which continues with the median eminence. This is the median eminence, still a part of the posterior pituitary. And jangan confuse with the infundibulum. Infundibular stalk and infundibulum is different. So infundibulum kat sini, it just this surround area. So infundibulum consists of adeno and neurohypophysis. Okay, sebab adeno dia ada pars tuberalis, okay, neurohypophysis dia ada infundibular stalk. So dua-dua ni kita panggil infundibular. Okay, jangan confuse infundibulum dengan infundibular stalk or stem. Okay, then still lagi posterior pituitary here, the axon. Okay, this is the axon arising from the group of hypothalamic neurons terminate in the neurohypophysis. Okay, group of neuron ada banyak, contohnya paraventricular nucleus, supraventricular nucleus. Okay, there's a lot of nucleus. Nanti you akan belajar CNS. There's a lot of nucleus present in the hypothalamus. And there is specific connection to the nucleus in the pituitary gland. Okay. Okay, so it forms the neurosecretory hypothalamo hypophyseal tract. Okay, ini nama dia tract dia. Okay, and terminates near the sinusoid. This is the sinusoid. Near sinusoid of the posterior lobe. Okay, this is the tract. Here is all the hypothalamo-hypophyseal tract. Dekat sini. Tak ada label tak ada label the tract. So yang this one yang purple ni. Okay, so these are the summarize apa yang beza dia. Adenohypophysis glandular, neurohypophysis neural tissue. Okay, these are the parts. Okay, the distalis, intermediate, and tuberalis. However, for the posterior pituitary, nervosa, infundibulum stem, and median eminence. Synthesize and secrete 7 hormone, store and release 2 hormone that produce in hypothalamus. Okay, again, the summary again. Okay, then we go to the arterial supply. There's several superior hypophyseal artery and 1 inferior hypophyseal artery. Okay, so this is a branch of the, both are branch from the internal carotid artery. So these are the arteries that supply the pituitary gland, superior and inferior. Superior ada banyak, inferior ada satu saja. Okay. Then the inferior hypophyseal artery divide into the medial and lateral branch, okay, which anastomose across the midline form an arterial ring around the infundibulum. Okay, just imagine lah dia ada medial and lateral branch, dia akan circle around the infundibulum. It anastomose each other, the branch of the inferior hypophyseal artery. Okay, superior hypophyseal artery supply the median eminence, upper infundibulum, and the lower infundibulum. Okay. Alright. So venous drainage ada 3 possible roads. Portal vessel, long or short portal veins, okay, to the adenohypophysis. Inferior hypophyseal vein, okay, large into the dural venous sinuses, and also via the capillaries. Passing the median eminence to the hypothalamus. These are the possible 3 roads for the venous drainage of the pituitary gland. Okay, hypothalamo-hypophyseal portal system. This is belong to the anterior pituitary. Okay, so it consists of 2 fenestrate capillaries connected by vein. The vein tu nama dia portal vein. Okay, and it provide link between both organ, hypothalamus, which is hypothalamus and pituitary, to for hormone release and hormone inhibiting hormone. And this portal system, it consists also there's present also the hypophyseal portal veins between the primary capillary plexus and secondary capillary plexus. Okay, the primary capillary plexus ada dekat median eminence, and secondary capillary plexus present at the pars distalis. Okay, inilah contohnya. This is the portal vein, okay, connecting to capillaries, primary capillary plexus and secondary capillary plexus. Okay, so it's form the portal system. Very special for the anterior pituitary, hypothalamo-hypophyseal portal system. Okay, the primary capillary plexus in upper infundibulum receive releasing and inhibitory neuroendocrine factor from hypothalamic nuclei. Okay, so they receive the inhibition or stimulation hormone from the hypothalamus. Nanti dia connect dekat anterior pituitary via the secondary capillary plexus. Okay. So the portal veins carry neuroendocrine factors to the adenohypophysis. So portal system ni ada connect posterior pituitary ke tak? hypothalamo-hypophyseal portal system. Is it linked with the posterior pituitary? Tak ada nampak gambar ni. Tak ada posterior pituitary. Anterior pituitary. Okay, tadi portal system. Now tract pula. Hypothalamo-hypophyseal tract. Okay. So this important anatomic and functional connection between hypothalamus and pituitary gland. Dalam lecture note you ada apa di sini?
Tak ada.
Tak ada apa-apa?
Tak ada apa.
Kotak juga macam ni?
Ya.
Sepatutnya arrow okay, consists of two connection tract. First, from the supraoptic and paraventral nuclei of hypothalamus. Okay. Tak apa, nanti you go to the hypothalamus, you akan ingat these dua nuclei. One is supraoptic and one is paraventricular. This nucleus dekat hypothalamus specific to release synthesize and release the vasopressin ataupun ADH. Sama I distracted dengan kat hidung tu ada apa sebenarnya? Tisu. Apa tu? Okay. Tak apa. Continue. Okay. Supraoptic and paraventricular. Okay, so ada dia di specific hormone dekat posterior pituitary, which is the vasopressin from the supraoptic and oxytocin from the paraventricular nucleus. Some of the book called vasopressin, some of the book called ADH, antidiuretic hormone, somewhere. Okay, so it is secreted in the capillary bed in the posterior lobe or neurohypophysis, secreted into venous circulation and secrete to the target organ. Okay, so tract kita perlukan tract untuk posterior pituitary. Okay, that tract from the hypothalamus. Okay, this is the tract special to the posterior pituitary. Okay, this is the example of the nucleus in hypothalamus. Hypothalamus banyak nucleus, you teringat juga nanti. And two of them are the supraoptic nucleus and paraventricular nucleus. Okay, hormone transported along the axons and released via the exocytosis at the axon terminal. Okay, to the posterior lobe. Okay, again, lagi satu cara track dia, the nuclei, saya daripada dua yang saya sebut tadi, which are the dorsal medial nucleus, ventral medial nucleus, and infundibular nucleus of the hypothalamus, secrete the hormone are stimulated and inhibit at the median eminence and stimulate or inhibiting the hormone release to the primary capillary plexus. Okay, tadi dekat anterior pituitary, okay, and in the median eminence and secrete and target the secondary capillary plexus via the hypophyseal portal vein to the pars distalis. Now, the tract also can stimulate the adenohypophysis or anterior pituitary, okay, and stimulate the pars distalis to secrete all the hormones and enter the secondary capillary plexus to the venous circulation and to the target organs. Okay, so the tract can involve both anterior and posterior pituitary. Okay. Again, these are the other nucleus selain daripada supraoptic and paraventricular tadi. Okay, these other nucleus in hypothalamus also can stimulate the superior hypophyseal artery, forming the primary capillary plexus and then secondary capillary plexus, and then secrete all the hormones also at the anterior pituitary. Okay. So these are just the summary of the hormones. Okay, hypothalamus. This is posterior pituitary, and this is the anterior pituitary. Okay, now we go to the histology part. Again, you might not see all the parts in the histology slide, but you can see there's obvious different of the staining in each pars. Okay, so this is the pars novosa. This belongs to anterior or posterior? Posterior pituitary. Okay, the pars distalis, the pars tuberalis, sikit ni, pars intermedia tepi. Okay. Now we go first with the anterior pituitary. The cell arranged in cords and nest with interweaving capillaries. All the capillaries, okay. Cells vary in size, shape, and staining properties. Okay. The histology of anterior pituitary, there's two types of cell identified based on the staining property, but not on the functional or hormonal activities. Okay. So you can see one is the chromophobes. Okay, dia phobia tu dia takut takut color. Okay, that's chromophobes. And one is the chromophils. Dia ada staining lah, the presence of the staining. Ada that staining either acidophils, okay, or basophils. Okay, so yang tak ada staining tu we call it chromophobes, which but sama 50% and 50%. Okay, so the chromophore cell, less stem cells, small cells, scanty cytoplasm, and indistinct cell membrane. However, the chromophil cell, you can see there's distinct cell boundaries, and the cytoplasm appeared pinkish or bluish. So kalau pinkish is acidophil, if bluish basophils. You tengok cytoplasm dia. Okay, kalau dia pale, that is chromophobes. Okay, so contoh this is a chromophore cell. Okay, at the pars distalis. Okay, this is the acidophil and also basophils. Okay, so this is another basophil. Okay, acidophil. So this look like the chromophobes. Okay, but this is special stain. Gomori trichome stain. So this is the, kalau you can identify that, so tropes, okay, container antilope, this acidophil or basophil, so these are the hormone, cell type, okay, that is the secretion of the hormone, tapi semua kena special stain untuk identify which specific cells in the anterior pituitary. Quite difficult in the H&E staining. Okay, this acidophil, it can be somatrope cells or lactotrope cells, okay? Or okay, the basophil, it might be corticotrope cell, gonadotrope cell, or tyrotrope cell. Okay, so it's difficult to see in the H&E staining. Okay, pars intermedia is just a rudimentary, okay, and poorly developed in humans, and somehow there's presence of also the cystic cavities. Okay, cystic cavities, residual lumens of Redsky pouch. Pernah dengar tak Redsky pouch? Embryology masa MSK pun ada? I'm not sure. Okay, so parenchyma cells surround the colloid field follicles and contain basophils and chromophore and secrete melanocyte stimulating hormone. Okay, this is the pars intermedia. So the macam somehow is difficult to appreciate in the slide as well because it poorly developed in human, more in animals. Okay, and kalau ada pun dia ada cavities, cystic cavities. This is how we differentiate of the pars intermedia in the slide. Okay. Alright, and pars tuberalis. Okay, this is the pars tuberalis. Funnel shape region surrounding the infundibulum. Highly vascular region containing veins of the hypothalamus hypophyseal system. cell arranged in small cluster of cords, okay, and presence of the squamous cell or small follicle lined with cuboidal cell. These are the certain hormonal release from the pars tuberculosis. Somehow it's a bit difficult also during the HNE, during the section of the slide. Okay, pars nervosa, composed of neural secretory tissue. Okay, it's not the endocrine gland. Not myelinated axons, cell body at the supraoptic and supraventricular nuclei of the hypothalamus. Okay, the cell body at hypothalamus. Contain the secretory vesicle in all part of the cell. Example, cell body, axon, and axon terminal. Axon terminal is dilated, to form the herring bodies. Okay, so the herring bodies is only present in the posterior pituitary gland. Okay, it's contained oxytocin or ATH. It appears as small island of eosin state. Okay, first, dia macam pale pars nervosa ni, posterior pituitary. I think dalam slide nanti you can appreciate which one is posterior pituitary, which one is anterior pituitary. It's easy to differentiate because tengok dia punya staining. Kalau pale, more pale is pars nervosa. Okay, this is the dilated terminal dilated axon. We call it herring bodies. Dia macam pink. Okay. Jadi pun you boleh nampak dekat posterior pituitary parts of the pituitary gland, herring bodies. Okay. And also there's one special cell also in posterior pituitary. We call it pituicide. Pituicides. Okay, pituicide is a highly branched glial cell. Okay, it's a part of glial cell. Glial cell to a bit of supporting cells of the nervous system. Associated with fenestrate capillaries. Okay, and the nuclei is round and oval. Kalau higher magnification, you can see the nucleus. And cytoplasm, kalau higher magnification, cytoplasm pun boleh nampak. The cytoplasm has pigment vesicles. Okay, so apa-apa glial cell is a supporting role. So posterior pituitary, you can see the pituicides as well as the hairy bodies. Okay, pituicide, and this is the hairy bodies. Okay, now we go to the embryology of the pituitary gland. Okay, anterior lobe, you can see a rise from the oral ectoderm. This is the oral ectoderm. Okay, and this part uprose from the roof of the mouth, which is the Retzky pouch. Dia macam ni hypophyseal pouch or Retzky pouch is the pouch. Okay, uprose from the roof of the mouth. The uprose of this part. Okay. And then the posterior lobe, this is the neuroectoderm. This is the posterior lobe. Arise from the neuroectoderm, which done growth of the diencephalon. Okay, this one dia akan jadi posterior lobe of the pituitary. This akan jadi anterior lobe of the pituitary. Okay, ingat ada dua perbezaan iaitu the embryology of anterior and posterior. Okay. During the further development, cells in the anterior wall of the Retzky pouch increase and form pars distalis and pars tuberalis. Okay, pars distalis and pars tuberalis, and a small attention of the slope surround the stalk of infundibulum forming the pars tuberalis. This is the pars tuberalis, surround the stalk. Okay, and pars distalis. Okay. Posterior wall of the Retzky pouch developed into pars intermedia. Okay, this is the pars intermedia developed from the posterior wall of the Retzky pouch. Okay, the infundibulum give rise to the pars nervosa. Okay, then what happened? This is a bit of applied anatomy. If let's say the presence of the pituitary tumor, give rise to two main category of symptom. Okay, general symptom due to pressure of the surrounding structure. Okay, soalnya kalau any pituitary tumor, the symptom is a compressive symptoms. Just pressing the structures nearby. So what happens if upward growth of pituitary tumors may press the optic chiasm and causing the visual disturbance. Okay, later dalam second semester also CNS dalam cranial nerve, there's the disturbance of the optic chiasm in the optic nerve. Laluan optic nerve tu panjang and involve the optic chiasm. Kalau ada macam progressive at the optic chiasm, okay, it can cause the eye sight problem. Okay, and then tumor can go up into the third ventricle, causing the hydrocephalus. So this is the third ventricle. Okay, this is the lecture in the second semester also CNS dekat the CSF lecture. So one part of the CSF we call it third ventricle. Okay, apa-apa yang obstruct the CSF can cause hydrocephalus. Okay, again optic chiasm. Okay, can press here. Okay, it can cause bitemporal. Okay, heavy bitemporal hemianopia. Okay, this is one of the symptoms in the optic tract punya pathway. Okay, then or it can be specific symptom due to cell type of the tumor. If let's say acidophil adenoma, it can cause acromegaly in adults, or chromophobe adenoma, it cause effect of the hypopituitarism. Okay. So this patient with hypopituitarism, kalau involve the prolactin, ineffective axon lactation, okay, gross hormone deficiency, abdominal obesity, reduced muscle mass, and impact quality of life. Okay, secondary adrenal insufficiency, can be acute or chronic. These are the symptoms. Hypothyroidism, okay, fatigue, lethargy, cold intolerance, constipation, dry skin, hair loss, and reduced energy and concentration. Hypogonadotropic hypogonism is sexual dysfunction, infertility, osteoporosis, poor concentration, and energy. Okay, if in women, in hypopituitary, it can cause oligomenorrhea or amenorrhea, no menses at all. Or in men, it can cause erectile dysfunction, decreased muscle mass, decreased hair growth, and anemia. Okay, so these are the features of the hypopituitarism. Okay, damage of posterior lobe. Okay, posterior lobe ada dua hormon saja kan. Okay, one is the ADH and one is oxytocin. Okay, if impact problem at the ADH, it can cause diabetes insipidus, not mellitus, diabetes insipidus. I think you will go through during the course of pathology in the endocrine system. And also if oxytocin problem, okay, it can stop uterine contraction during the birth, okay, process. It's difficult for spontaneous vaginal delivery, and also the prevent milk ejection after giving birth. Okay, these are the example of the pathology of the posterior pituitary gland. Alright, okay, thank you very much. Any question? Okay, I need my attendance. Kalau ada, I nak jumpa 3 student research project I dekat depan ni. Okay. 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 Siapa lagi? Student Mana? Okay. Okay, kalau ada apa-apa just ask me in front